A little bit about myself. My name is Ticey Czup. I am a clinical pharmacist at ACMC. I've been there for, well, off and on. I was PRN, but I've been at this job for about 6 months. Before that, I worked retail for 22 years, so I have a little bit more retail experience than not. Julie asked us to come and talk about some weight loss drugs. I know people always ask questions about those kind of things, and it would be great if everybody could just take a magic pill and, look like beauty queens, but that's not always the case. So I kind of want to give you a rundown of what's available and the side effects and the cautions on these kind of things. I really don't love a whole lot of diet pills just because I know the side effects that they can cause, and they're not always the best thing for people with the best results. But I want to give you some education on what is out there, and in case you have any questions, we can go from there. So, first of all, usually if anybody is going to go on medication, if you can't hear me, just yell and I'll yell louder. If you're going to go on a medication, the doctors will usually base that not off just your weight, but your BMI, and I'm sure you guys have heard of that, and that's a calculation with your weight in pounds plus your and your height, and they kind of calculate it that way to decide if we're underweight, within the right weight limit, overweight, or obese. And then it kind of depends on what your target is and where you fall in that category. So they figure that, weight loss, or if you're underweight, you're less than 18.5. If you ask me, it's kind of a small window. A lot of us are in the overweight or obese section it doesn't even seem like that, but this is kind of how they classify the healthy weight, goal weights. The recommendations for weight management, and I'm sure you guys are learning about that in this program. Diet and exercise are really the best. They take a long time and they're hard, but that's really the best and the healthiest thing for you. The more you move, the better it is for your body. The less junk you eat, especially. Behavior modification is always a good thing. That's why some groups like this are great. It kind of helps you change your lifestyle a little bit. Then there's medications, and surgery is also an option. The weight loss recommendation, diet and exercise and behavior is really like the best way to do it. Pills you can only take for so long, and they can only do so much. If you can change your diet and change your lifestyle, that's the best way. Sometimes you have to figure out a way to fit exercise in, or learn how to cook different so you're not eating the same stuff that you were before, or different amounts, and that's really the best. Usually people can achieve a 5 to 10% reduction in weight by doing those kind of things. It also helps to decrease your risk of type 2 diabetes, of high cholesterol, of hypertension, of heart disease. So it's always a good thing to have your optimal weight. Hope I'm not being followed up by the funeral director.
You're safe, Ticey. You're safe.
There's several drugs that are approved by the FDA for weight loss and for maintenance, and then there's also bariatric surgery, which is pretty effective for most people, but it also has its risks, just like the drugs. Those things have benefits, but they also have risks involved with it. So with a diet intervention, most people can lose 1 to 2 pounds a week just by decreasing their calories by 500 to 1,000 less calories a day. So an 800 to 1,500 calorie diet is like optimal to kind of decrease your weight. If you go too low calorie, then that can cause some problems with gallstones and kidney stones, and you have to have enough to survive, so your body doesn't start rejecting itself. Lifestyle interventions, the low calorie diets are kind of a better. That's a good way to stick to things. There's also all those diets out there like keto and, high fat, high protein, low carbs, all that stuff. Those are great too. Sometimes those are a little bit harder to maintain just because, you're narrowing your amount of things that you can eat. So, that isn't really my area of expertise, but that's, what the options are out there. Behavior modifications are always a great thing too, and that to go in with that only because I know all of us are like, I'm super busy, I don't know how I have time to do any of those other things. You know, in order for me to fit my workout in, I had to get up at 4 o'clock in the morning so I can go before work, and that was a huge life adjustment for me when I started doing that. So, you know, there's different things. So having friends to help you out and having a group, that always helps. And or there's, you know, apps, a zillion apps about those kind of things too. Okay, so the reason I'm here is to talk about the drugs. Usually, in order to be put on any weight loss medication, you have to have a BMI of 30 or more, or if it's a 27 and you have comorbidities, which would be diabetes, hypertension, high cholesterol, heart disease, and they can usually decrease your A1C more than just with the lifestyle modification. So they are helpful for certain people who really need it. You have to watch, though, if you do lose weight from any, you know, method, you may have to have an adjustment in your medication, which a lot of people don't always think of that. You know, oh, I'm going to lose weight because I'm going to be healthier, but then they forget that they're taking a ton of insulin and metformin and all these things. Well, you might not need it as much anymore if your body is, if you lose that weight. So make sure you talk to your doctor if you are going through any weight loss issues. Your medications may need to be adjusted. A lot of medications are based on weight, so if you suddenly drop 20 pounds, you could have a different dose that you might need. Or be able to cut it out, which is great, but you know, you don't want to keep taking that same amount. So one of the oldest drugs that have been around forever is Adipex or phentermine. This is kind of like it's kind of like speed. It increases your heart rate, it increases your metabolism, but what it is an appetite suppressant. So sometimes it will help people kind of have a little more energy. It makes you not want to eat as much. So it does help some. But most studies have found that most people only lose less than a pound a week. So it's really not like, great, and you're going to lose a ton of weight. There's also like legal limits on this. You can only be on it for 12 weeks at a time, and then you have to have 6 months off before you can be on it again. So it's really you can only be on it like once a year for that 12 weeks. So sometimes people need it as like a kickstart to kind of get themselves motivated to keep going, but then you know you can't be on it longer than that. It can be addictive. This is something that, oops, okay, thought I missed a slide. The other one that's in this family is this Qsymia, which has phentermine, the Adipex in it, plus also topiramate, which topiramate is Topamax, which it's a anti-seizure medicine is what it started out to be. Some people take it for migraines. They use it for a lot of different things, but they have found that this combination of drug seems to work the best out of all of the diet drugs. There are some restrictions on it, and the manufacturer recommends that if you don't lose at 5% of your weight loss or 5% of your weight within 12 weeks, then it should be stopped. It's not really doing the trick if you haven't lost at least 5% of your body weight. This isn't something that you want to continue. If you woke up and you got busy on your day and you forgot to take it, usually you would either take it when you remembered, but if you forgot to take it before you went to work and then you didn't remember till you got home, just skip that dose. Skipping one dose isn't that big of a deal. Your blood levels don't go too low. But if you were taking it all along and then just decided I don't want to take this anymore and stopped, then it can cause some rebound side effects. But just one dose probably wouldn't do it. And when I say go off slowly, it's like over the course of a week. You might take it, if you're taking it twice a day, you take it once a day for a couple days, then you take it every other day for a couple days. And that would be it. It wouldn't be that long, drawn out kind of thing.
Mm-hmm. Just a comment. I had a friend who was on this Victoza. She was diabetic, and she lost 20, 30 pounds.
Mm-hmm. That one does help. And that was another thing. They found out people were losing all this weight from the Victoza helping their diabetes, and it does help. So now they're marketing it as a weight loss drug for other people. It does help, and it seems like a safer option. But then if you're not diabetic, then it can run the risk of causing, the hypoglycemia and things like that. So, when you're diabetic and you need it, that's not why they're taking it. They're taking it for the insulin resistance. But then as a bonus side effect, you lose some weight too, so it helps. And that one is, not addictive. It doesn't mess with your heart rate. It doesn't, that one is a little more medical reasons rather than just.
Is that Victoza in a pill form, or that's just an injection?
That's an injection.
Yeah, it's an injection.
It's not in pill form.
Actually, the one that they. Sorry, I was clicking that in my pocket. Yeah, this Saxenda is the way it's pronounced, and that I have never actually even dispensed that. I don't know how often they use that or if it's available, and if it is priced anything like Victoza, I don't think anybody would ever use it because it would be really expensive. I probably should have looked up. I'm sorry, check that.
So what you're saying is it's cheaper to just watch your habits.
Oh, for sure. It's probably
Spend money on a pill or injection.
right. Yeah, it's definitely an investment to do any of this for the most part. And like I said, every insurance is different. Maybe if you have certain, jump through the hoops and have certain comorbidities and they want you to lose the weight, maybe it can get it covered. But I'm sure, for sure, it would be a prior authorization. But I've never seen it covered for anybody.